My name is Dr. Jatish Kaler, and I became a naturopathic doctor to help people heal fully and wholly with natural medicines. It was around the time that I was attending pre-medical school at the University of Calgary when my mother was afflicted with her own health concerns. And it was at that time that I saw her heal, not only with a combination of natural remedies, but conventional medicine as well. So I really saw the power of integrative medicine at work before my very eyes. So at that time, my interest in natural medicine really grew. And so I ended up attending a 4-year college in Vancouver, British Columbia, the Boucher Institute of Naturopathic Medicine. After that, I practiced medicine in Winnipeg, Manitoba, as well as Calgary, Alberta. What I like about naturopathic medicine is that it truly aligns with my ideals for treating a patient and fighting disease. We believe food is medicine and that medicine is food. So we talk about nutrition and how that can be impacting your overall health and well-being. We spend a great deal of time with our patients so that we can get to the bottom of the issue, take a complete and thorough history as well as physical exam, as well as talk about the various treatment options in depth with the patient and their family members as well. I like that it allows me to practice what I preach. So I have to walk the walk and talk the talk. It describes me to a lifelong learning, not only about myself, but about my patients. And I get to wake up each day and learn about the human body, about medicine, and about disease. During my first visit with a patient, we spend about an hour together. We go over various aspects of their overall health and well-being, such as past medical history, current health concerns, as well as various barriers to their health, such as sleep, stress, exercise, and energy levels. We also will talk about supplements that they might be taking, as well as medications. To address these issues, I'll use a combination of nutritional counseling, dietary modifications, as well as natural supplements, such as minerals, vitamins, and herbs. There also might be an additional injection of vitamins or nutrients intravenously or intramuscularly, as well as acupuncture. While I help people with all kinds of health issues, my primary areas of passion relate to digestive health. So issues such as IBS, chronic stomach pain, food sensitivities, inflammatory bowel diseases such as ulcerative colitis and Crohn's, as well as intestinal bacterial imbalances. Other areas of interest for me include chronic low energy, insomnia, anxiety and depression, as well as chronic pain. I've had many meaningful patient experiences throughout the years. I think one in particular that stands out was a patient that came to me with symptoms of irritable bowel syndrome. And her work involved getting a lot of meals that were provided and catered for them, and she found it very difficult to navigate this minefield. She wasn't aware of which foods were her triggers and which weren't. So after spending a few sessions with her, going over a complete diet history, as well as testing for various food sensitivities, we were able to identify a primary trigger for her. So a couple weeks later, after I put her on a couple supplements, as well as eliminating a variety of different foods that we felt would be contributing, she came back to me and she was overwhelmed with happiness. So she was able to actually make educated food choices now. She knew how to manage her symptoms, and she knew how much of a food she could tolerate and at what times of the day. I've had many additional good experiences with patients over the years. Symptoms and conditions that I was able to help resolve significantly or even completely. Issues with anxiety, insomnia, chronic low energy, chronic pain, and skin issues such as eczema and acne.